Welcome to the Happy Doc, the voice of fulfilled physicians. This show is about bringing inspirational, creative, successful, and happy health professionals to you. Get ready to learn how you can be a happy doctor too. This episode is sponsored by locumstory.com. Shares the ups, downs, and all-around adventures physicians have while doing locum tenens assignments. Whether you are fighting burnout, want to see the world, or just need a change of pace, locum tenens may be just what you need. Learn more about how locum tenens works, trends in the industry, and read inspiring physician stories at locumstory.com. That's LOCUM story.com.
I knew you were trouble when you walked in, so shame on me now. Flew me to places I've never been, till you put me down. Oh, I knew you were trouble when you walked in, so shame on me now. Flew me to places I've never been. Now I'm lying on the cold hard ground. Oh.
Trouble, trouble, trouble. What's up, guys? That song is part of Nicholas Chadi's group. He's our next guest for this episode, and that's his group, The 8 Tracks. In this episode, we're going to learn about Dr. Nicholas Chadi's medical journey. We're going to jump into a conversation about addiction medicine and what he tells teens about marijuana use. We're going to learn about the simple stop and washing hands mindfulness practice that Dr. Chadi uses and teaches. We learn how music has improved Dr. Chadi's ability to study as a student. We learn about the moments that make Dr. Chadi feel fulfilled in medicine. We learn why your life doesn't end when you start medical school. And we learn about a simple tip that Dr. Chadi has for the listeners. You can reach out to Dr. Nicholas Chadi at nicholaschadi.com, and you can find him on Twitter at Nicholas Chadi. Also, you can find his group, The 8 Tracks, by searching on Facebook, The 8 Tracks, or you can also look them up on YouTube. Hello, everyone, and welcome to another episode of The Happy Doc. This is your host, Dr. Taylor Brana, and in this episode, we have Dr. Nicholas Chadi, who is a pediatrician specialized in adolescent medicine. He's currently the first pediatric addiction medicine fellow in North America and is training at Boston Children's Hospital. He's also a researcher, a mindfulness practitioner and provider, a musician, a writer, and a sports enthusiast. So we have Nicholas Chadi on today. Can you say hello to everyone?
Hi, Taylor. Hi, everyone.
Amazing. Love it. You have a lot of amazing talents. I know we're going to get into that. So before we begin, can you tell us a little bit about your medical journey and how you arrived here today? I know it's a big question, but kind of in short.
Sure, absolutely. So this would be, I guess, the end of year 6 in terms of postgraduate training, 11 years since I started medical school. If I go way back, I decided to go into medical school after working in summer camps. So I worked as a lifeguard as a teenager. I was put in a healthcare sort of provider role without any knowledge. A lot of teens would come to me with mental health issues, eating disorders, feeling anxious, and I felt really helpless. And I thought, hey, maybe this is something that I could do, somewhere I could help. And then I did a music degree for a few years. I wasn't too sure where my life was going, and then eventually decided to do the jump into medical school, really thinking that working with teens more in mental health would be what would be my focus later on. And I guess medical school went by, and then I applied to both pediatrics and psychiatry, thinking one or the other probably would be a good fit. I went to pediatrics, then specialized in adolescent medicine, and here I am now working almost full-time in addiction medicine with teens, young adults, with kind of a full spectrum of addiction issues, and I find it fascinating. Yeah.
Wow, that's amazing. So in terms of let's go first into kind of the adolescent group. Do you feel like it was a lot of that summer camp experience that kind of pulled you towards that group specifically and not like a different age group?
Yeah, I do think so. And just to say a little bit more about that summer camp experience. So I worked in day camps and then summer camps as a teen. And then my mom was a stay-at-home mom until I was 18. And so one summer, at the end of the summer, the owner of the summer summer camp I was working at was going to close down the camp. And then I just jokingly came back home and said, Mom, why don't you buy the camp? Why don't you run this place? And she actually did. So 13 years later, my parents still run, it's an English immersion summer camp up in Quebec, north of Montreal. So I was very involved with that camp, building leadership programs for youth, building bike trip programs, training staff that were, teens, young adults. So I really enjoyed working with that age group. So both the older campers and also the staff members that were kind of late teens. And so many issues came up. So I really I think, consolidated my interest for working with teens at that point.
I love that. That's amazing. And, something about that, before you even went into medical training, you had like a good grip of that age group. And, obviously, this, working with kids, working with infants versus toddlers versus, young children going into adolescence. Each group is like their own different personality and energy. And I only know this because my mom, has this daycare center and I always worked with her. And the kids, they're so different. So that's great that you kind of found that group that you really, worked well with you. So in terms of addiction, what kind of drove that interest for you?
I think I've always been really interested in kind of substance use in general. Now it's a time of marijuana legalization. I'm from Canada. We're just about to legalize countrywide. There's a lot of this going on here in the U.S. as well. I think a personal experience happened when I was just starting grade 7, and my friend in the school bus was selling drugs a lot. He was 12 years old, and he got into a lot of trouble for that. Had to change schools, drop out of school eventually, and I think it really stuck to me. I guess in my peer group there was a lot of drug use at a young age, so I felt like that was definitely an area that I could make a difference.
Wow. Yeah. Amazing. So, as I'm listening to your story, there's so many things I can unpack with you, which I think is going to be interesting. So Canada, first you're training in Canada, correct?
Right. So now I'm in Boston, and I did all of my training before that in Canada.
Right. Yeah. So I just for my own education, what's the difference in terms of, Canadian and American medical education?
I think in many ways it's very similar. My little difference was that I took sort of a shortcut into medicine. I did not quite a college degree in music and science, then 1 year pre-med and straight into medical school. It was 4 years. Then residency had a very similar structure. My boards were pretty equivalent. I took the American boards as well. But other than that, I think it's very similar.
Sure. Now, do Canadians face the same challenge as other international medical students getting into programs?
I think because our residency is recognized as equivalent, we don't. We definitely have visa issues. But aside from that, I think we have it much easier than other, international applicants, for example.
Amazing. So let's come back to kind of the addiction conversation. You opened up, the box of marijuana. So what are your thoughts on, the use of marijuana, not just in, we can talk about general, but how about in the teenager population? How do you have that discussion with teenagers?
Right. So this is obviously something I'm very passionate about, something I do research about, sort of perceived riskiness of marijuana. What should parents tell their kids about marijuana? How should providers talk to teens about marijuana? I think, first of all, I do think that having more of a discussion about it, so talking about legalization is a good thing. I think a lot of it is how we do it and how we approach it. And I think that always what is not talked about enough is the public education piece, really. So I think my lens, usually from the point of view of a pediatrician, is trying to educate whoever I'm talking with. So obviously I do a lot of reading about this and a lot of research. So I try to be up to speed on what the science says about what might be the risks of using marijuana when you're a teen. And because I work with young people, I'm most interested in sort of what marijuana can do to the developing brain. Right. So impacts on learning and memory and all that stuff. So this is information I want to share with the young people I work with, whether or not they've used or, regardless of their opinions about that. And then I want to hear from them. I want to know what they know. And, I want to hear what they're hearing and where their information comes from so we can have an educated discussion about it.
Sure. And I haven't done as much of a look into kind of adolescence and marijuana use. What is the risks and the benefits benefits kind of conversation that you have? I know people will be curious about that. What conversation do you have?
Yeah, so I like to ask teens why they use. So like, what do they like about marijuana? What is it doing for them? So obviously, a lot of the times it's a social thing. I hear a lot, marijuana helps me relax. Sometimes they'll say it helps me focus. It helps with my anxiety. Some teens will even say nowadays, oh, it's my medication, even if they're not, using it in a really medical, context or application. And then I try to dig a little deeper and understand where that all comes from. Because when we look at the flip sides and the research, well, we do see strong associations between using marijuana when you're young and developing anxiety, depression, suicidality, schizophrenia. The risks are much, much increased if you are exposed consistently to marijuana. And the marijuana products that we see now versus 10, 20, 30, 40 years ago are much stronger. There's a lot more, the THC, the psychoactive component. And so some teens know that, some teens don't really know that.
Sure.
And there's still some controversy around, does marijuana really affect intelligence, IQ, memory, learning? What I see is that it really affects motivation to do things. And we are starting to see some longitudinal studies showing that there would be an effect on IQ and performance in graduating college and high school. So this is information that I want to share with parents, with young people.
Amazing. I love that. And I think, because there's kind of, it's more of a taboo subject. I don't think everyone's completely, even on the physician side, 100% comfortable having that conversation. But it's so ubiquitous within like populations, especially teenagers, to use it, that it's very enlightening even for myself to like listen to you talk about or understand how to have that discussion. So I like really thank you for being on today. That's like a really powerful conversation. And I want to tie this in because I know you have an interest in mindfulness. And I know this will be very helpful in the conversation, especially with like teenagers. How often do you find that the use of these drugs or addictions, it's kind of an escape? How often do you think that's kind of in the conversation?
Yeah, I wish I could give you a number or percentage, but I feel like it's very often.
Yeah.
Obviously, I'm a little bit skewed in the population that I see because I work primarily in more specialized addiction treatment programs. So I do see a lot of teens that, have more severe patterns of use or have, experienced problems from using it. But definitely, so you mentioned mindfulness.
Yeah.
So mindfulness is a personal interest of mine. I went into it as a medical student. I was so curious about what mindfulness was. I was hearing all about these mindfulness classes and I wanted to learn more about it. I was pretty stressed as a medical student in my clerkship rotations. I was putting a ton of pressure on myself. I was feeling the pressure from others and I felt that would be a nice escape. And so I went into it from more of a skeptical / I want to do research about this type of approach. And that's what I did. So as I was learning how to practice mindfulness, as I was going on retreats and, doing different training courses, I was also studying mindfulness interventions in adolescents, primarily adolescents with chronic pain problems, chronic medical illnesses, chronic mental health in my everyday practice. So most patients that I see, I'll eventually introduce some elements of mindfulness with them in my visits. So that could be doing short meditations with them, learning very concrete coping skills. It could be breathing exercises, it could be muscle tension relaxation, body awareness exercises that all really fall in what I call mindfulness. And it can really help with that idea that for a lot of teens, drugs is the only way that I can escape or that I can cope or that, I can go through my day. And I think mindfulness is a great example of something that has little or no side effects and that can really be applied and take that space.
Amazing. So it's funny right now I'm listening to the audiobook. I'm sure you're familiar. Eckhart Tolle, The Power of Now. Have you heard of it?
I have, yeah.
Yeah, so that book is all about the power of the present moment, which is obviously within the scope of mindfulness. And it's very important, too, because maybe, for example, a teenager saying, I want to smoke marijuana because, I'm getting really anxious right now. Well, maybe instead of grabbing that joint or whatever, they're present in that moment and they're just feeling the anxiety. I would love, and I know some listeners are listening to this while they're driving, so please like skip this or don't practice this, but can you give us like maybe an example of a mindfulness practice right now?
Sure. So a quick practice that I like to teach is what I call a stop practice. It's something you can do at any time if you're feeling anxious, if you're feeling tense, if you feel like your day is just going too fast and you want to take a minute. So stop for S-T-O-P. So what you would start doing is stop whatever you're doing. So if you're driving, obviously continue driving, but just take a moment. And the T goes for take 3 breaths. Just feel the air coming into your mouth, your nose, your airways. Feel what that is doing for you in the moment. And then just observe that for a few moments. So really the focus is on you, your breathing, and the present moment, exactly what you were mentioning. And as you continue to do that, just think of how you'll proceed with the rest of your day or whatever you'll do next, right? And get ready to do that mindfully and in the present moment. So that was maybe 25, 30 seconds.
Yeah.
It's a practice that I do a lot with my patients, that I do myself. It could be longer, it could be shorter. There's a ton of great recordings online that you can listen to someone guiding you through a practice like this. But this is just one of many examples.
Yeah, no, and I love that. Something that I've noticed in a lot of mindfulness classes and courses and talking about it with other individuals is once they do it, they're like, wait, I've lived like 30 years not being present, because so many people, like, they're kind of there, but there's some thoughts lingering, and it really is a different experience. So I appreciate you bringing that up. I love that.
Right, and it can be something even simpler than that. I think the first way that I really integrated present moment awareness in my medical training was by washing my hands mindfully. So first, if you wash your hands or you gel your hands probably 50, 100 times a day.
Sure.
So I built the habit of always doing that mindfully. So just being super focused on washing my hands and nothing else, or checking in with, my thoughts and what's going on at that time. And I felt that I was doing mindfulness so many times a day. And that for me was a nice way to be in the present.
And that's a really good technique, because what you did was you anchored the washing of your hands with saying, I'm going to be present right now. And then you did it so many times throughout the day that you were kind of doing training, coming back to present moment, which is the whole point of meditation for anyone who practices that. In meditation, when your mind wanders, you come back because that's like your mental push-up. You pressed your mind into saying, I'm going to be strong and I'm going to be here. And I love that anchor technique. I'm probably going to use it right now. So guys, this conversation was for everyone else, but actually selfishly for me right now. I'm just kidding. But that's amazing. I love it. So we have a conversation now. We've talked about marijuana. We talked about addiction. We've talked about mindfulness. That's amazing. And I know you also have some musical talents as well. And I would love for us to kind of dive into that. How do you think that, the creative aspects of who you are impact you in a medical sense?
Right. So I think probably the toughest decision that I had to take in my life was to decide between going into more advanced music education versus going to medical school. I was finishing my college degree, preparing auditions to do a performance major, or going to medical school. And eventually I figured I was practicing 3, 4, 5 hours of piano, singing, violin every day. And, it does get a little bit lonely. And, I was probably a decent piano player, but not the best in my school and not the best in my town. And I figured I can maybe make a difference if I'm a doctor and continue to play music, but I can't play music full time and then doctor part-time. So that didn't work. So with that in mind, I went into medical school thinking I cannot let go of my passion, music. So, I grew up playing violin, classical music, and then eventually I went to jazz piano in college, was playing with small groups. I was doing, cocktail gigs and things like that, and it was super fun. And I was singing in groups and choirs, and I didn't want to let go of that. So I really took it upon myself to put that as one of my priorities. So, when I think of even now as a 6th year, resident or fellow, I usually try to put in my music commitments first in my schedule. So
I love that.
every Monday night I have my a cappella group rehearsals, and every Tuesday night I have, my choir rehearsals. And then between that, I fit in piano or singing on my own. And, I go out to see live music because I really enjoy that. So it's really followed me. And really, music is one of those things that you can, do more intensely at some point and then a little bit less at another point, and then always come back to it and revisit it in a different form. So I think to answer your question, how has that impacted my path as a medical trainee, and I guess as a pediatrician now, I think it's just this creative part of me that's speaking. So, I feel like it probably makes me a more relaxed, more present, probably more passionate physician, having those outlets to also explore creatively and continue to work on my passion. I love that's music. Yeah,
I love it. I have a few questions. Do you perform for patients or anything like that?
Yeah, so actually that's probably how I started. So I started taking private piano lessons as a 5-6-year-old, and we would always play in retirement homes with my teacher. So I would do that as a kid, as a teen, and then in medical school, I put together a little choir, and we would sing in the hospital, and I would also volunteer and kind of roll around with my keyboard on the wards and play jazz piano for patients and families. And I thought it was a really nice way to give back and also kind of share that energy with people around. I still definitely perform. More recently, I put together a fundraiser for the Canadian Cancer Society, and did a rehearsal with a singer who's a friend of mine and also now an internist. And I think there's so many opportunities to continue to do that.
100%. I mean, health and music. Even, in terms of psychiatry, for example, there's been studies that have come out. People in delirium and ICUs, for example, it's huge to play familiar music, create the setting that is very comfortable for them. It keeps them kind of more with it. And so when they come out of that state, they're able to retain a lot of their mental faculties. And so I think, there's a lot of power in music. In terms of music, me included, I play piano, and I know there's a lot of people who aren't just logic focused, but also creativity focused as well, and practice that. What are some tips, going through this training, going through the difficulties of medicine, having obviously lots of hours of working? How do you maintain that part of you, and how do you kind of express that in a world that often feels like it really doesn't highlight that?
Right. Well, I think if I reflect back to medical school, and what I found the most difficult in training was probably those long hours, long days of studying and being in books and doing the same thing over and over. I quickly realized that by breaking it up and going to music, for a few minutes or a few hours, throughout the week, it really helped me increase my productivity. So sometimes it's not so much the number of hours you put in, and it's just, finding those breaks or just going back to it. And for me, music was a way to sort of energize and lighten up and brighten up. So I don't think I've ever had a time where a staff or a supervisor told me, no, you can't do that performance, or, this day off you've asked for 2 months ago to do this music thing, you can't do it because so and so reason. So I think I was trying to plan it well and be proactive about it. And then, I guess in the end, it just remained a really nice way to stay balanced.
Yeah, that's so valuable. And even when I reflect, a lot of people don't know this about me, but I love breakdancing. So it's like my little thing. And we actually started a breakdancing club at school, and we had some fun with it. So I think, as you and I are talking and opening it up to everyone else, that creativity of saying, I'm not going to let that skill or that talent or that piece of art within me die. I'm going to create ways of implementing it. I mean, you and I are in agreement. Me going out and dancing for a little bit was so energizing, as the word you put it, and allowed me to come back to whatever else I was doing in a better way. So
right. Yeah, no, I love this. Like, breakdancing is such a great example, and there's so many other art forms that, people explore, and it's so great to see that.
Yeah, no, and for anyone listening, don't undervalue the creativity, the artistic part of you. No one is going to put you down. As you're listening to this, we support you in your journey of expressing that, because I think it's that logic and that art that really changes things. I mean, I think even the movies, the things that really make us feel great inside, it's that combination. And so keep practicing that artistry. And Nicholas, you're an example of that. And, with your music, for example, which everyone's going to listen to, they're going to get a sense of that artistry that can still be there with medicine, which I think is very, very important. Now, to take a more big picture view, one of the questions we ask is, what does it mean to be fulfilled? And I know it's a big question, but when you think about your life, what does that mean for you?
So I think the easiest way for me to answer that question is I feel fulfilled every time I'm with a patient. And I get this feeling running through my body, that shiver, where I feel a deep connection with a patient, where I feel like, wow, maybe I might be making a difference here. The young person, I work with teens, they'll say, I understand. Yes, I'll do this. I'll make that change. I'll stop using drugs. I won't inject heroin anymore. I want to do that. So I guess all those little moments where you feel that you can impact someone's life, and that all those years of medical training and all those things, all those hurdles you've had to jump, maybe actually have been worth it. So that for me is my energy, even beyond, playing music or escaping or doing anything I do on the side, just really going back to, what I'm so passionate about, what brought me into medicine, and getting that validation. And sometimes that validation will come from families, from parents that'll, send you an email and 2 years later you haven't heard from a family or a patient, and they'll just, tell you, hey, I just graduated high school, or I'm doing this and that. And those are so meaningful, and they keep you moving forward and wanting to do more of what you do.
Amazing. I love that. So no specifiers, of course, but can you give me an example of a story, a moment that was really impactful for you in that way?
Yeah, well, I think those moments happen a lot in times of transition. So as a resident or medical student, our rotations sometimes are really short. So sometimes we'll be on a service for a month, and then we'll have to, move on to something else. And during my adolescent medicine fellowship, I was a fellow for 2 years in Toronto, and I had a continuity clinic. And so this one patient, I think, was my most challenging patient I've ever had. He was a young teen. He was rebellious. He didn't want to talk with me. And when I did his first assessment for severe marijuana problems and delinquency and, bullying, he stormed out and, shut the door. And then his mom called the clinic the next day and said, my son wants to see you of all the doctors he's seen. And from there, we built a really good connection, and that lasted for 2 years. And when I had to transition out and transfer, my patient to a colleague, he told me, he's like, I don't know what I'm going to do. You really changed my life. Now I'm going to school. He wasn't going to school. He went back into school. He had legal issues, and those were all getting sorted out, and so I could see the progression. And I think it was so strong to see that happen. Yeah. Right. And so I think those happen, that transition kind of brought that more objectively, but those moments do happen, I feel, a lot, especially when you work with teenagers, because things go quickly and a lot of it is black and white. And, sometimes they'll transition to an adult provider or you lose them, but those moments do happen a lot.
Wow, that's really powerful. And I loved what you said, that the moment of change. I think thematically with a lot of people I'm speaking to, that's that's our drug. Our little thing we're searching for is that aha moment, or those moments of change. And so I really appreciate it. But everyone listening, don't get addicted to that drug, okay? No, that's great. So looking at your journey, if you looked back, maybe going into medical school or even pre-medical school, let's actually, I'm going to separate this in parts. Before medical school and going to medical training, is there something you wish you had done differently or you would have changed looking back?
Yeah, and hindsight is always 20/20. Right. I think I went into mindfulness and meditation during medical training. I think that would have been such a great tool to have, from the start, from the get-go. I was a really anxious, teen. I was putting so much pressure on myself. I wanted to always do as good as I could. I was feeling pressure from my parents sometimes. I think just that idea that I should be focusing on what I'm doing and enjoying, whatever life was bringing to me at that time. And I think mindfulness would have been a really nice way of doing that. So I think I wish I sort of had that mindset a little bit earlier on. And that's a hard thing because teens or when we're younger, our brains aren't actually really wired so well to do that. It really comes as you get older, but I think there would have been a way probably to do more of that.
Yeah, definitely. And I 100% agree with you. I think the earlier you learn that, it really is life-changing. It was for me, so I love that. Do you think there are any changes during medical training that you would have or anything since, or would that probably be your main change?
I don't think I have many things that I would have changed. I think I enjoyed where I went to medical school. I chose a longitudinal clerkship program that was, outside of the main campus, which some people said was a questionable choice because it was all new and, would have given me the same quality of medical education. I think I learned a ton from that, and it was a more relaxed environment. I was sort of actively contributing to creating my medical curriculum, and that really worked well for me. And so I don't think I have that many regrets. I was fine. I went to McGill for medical school and I really enjoyed it. So I don't think I have any real changes that I would have made.
Great. I love it. What do you think is a habit or a skill that you have implemented that's made you either happy or successful in your life?
Yeah, I think a big part of why and how I got to medical school was sort of being organized and disciplined. And I learned a lot of that learning music, actually, sitting down behind the piano 30, 60 minutes every day and just being consistent with it. And I think that I have this sort of approach to most things in my life now. So I know that I really enjoy singing. So I schedule these rehearsals and I sort of plan it in a sort of rational way so that I have these scheduled times to be free and, to do those things. And I think that skill has really served me well in different spheres of my life. That also works for, enjoying social time with family, with, friends and all that. So, yeah.
Yeah. I mean, discipline is such an important skill, and that's great. You're exemplifying it, and I love that tip. That's a great tip. Now, speaking of tips, is there any tips you would like to leave to the listeners today from your journey?
Yeah, I think I hear from a lot of more junior medical students or trainees I work with, things like, oh, my life ends when I start medical school, or, I'm never going to be able to do this again, or I'll have to compromise or sacrifice. I think we should really be flipping this around and thinking, medical school or training is a new beginning, and how can I just build on this fascinating new, area of my life that I'm developing, all those skills that I'm building, this career that I'm, crafting. How can I integrate all those things that brought me here into that, right? So how can you, the unique you that got into medical school, how can you continue to be that person even better as, a skilled provider later on in life? It probably shows, but I'm a really positive and optimistic person. And, I feel that for most things, whenever you feel that you can do it, or you want to commit to doing something, it's usually a possible thing that will happen in the end. So having that approach and not seeing, medical school as this giant obstacle to being what you want to be or who you want to be, and kind of flipping it around and seeing it even as an enabler. Although, let's not kid ourselves, medical school is hard and there will be multiple challenges, but it doesn't mean that we can't be positive through it. And I think that comes from taking care of ourselves and doing the things that we like and that we love. And when we need help, that we get that help from people around us that can support us through it too.
I love that. I couldn't have said it better myself. Beautiful. And as we're talking about this, you highlighted a few things. I just want to again just highlight these main points. You said self-care is super important. You used words like crafting your career. Crafting, meaning inside you feel like you can carve your way. And so there's a lot of control in that, which I think is really powerful. A lot of people feel powerless because they don't think they have control. And I think that's super, super powerful. And just positivity. Go with this process with a lightness in your heart and doing it like that. I loved those tips. Is there any question you feel like I didn't ask you and you really, really felt compelled to tell me something or tell our listeners today?
Let me think about this for a second.
Yeah.
Well, first, I think it's been really great discussion, and I really like what you do, and this podcast is a great idea. I think one thing that I've been doing more of, and you do that a lot, is trying to reach out to different people in different audiences, and not just do medicine as a day job. So last year, during my adolescent medicine fellowship, I studied journalism. I did a global journalism fellowship, which allowed me to touch on different forms of media. So radio, podcasting, writing for newspapers and other, outlets. And it's really something that I enjoy doing. And I think that, as we're into this sort of age of technology and global media, we as doctors or as, medical trainees have such a great opportunity to, share what we do, what we see with so many other people. And that's just another way that I found, validation in what I do and energy to keep doing what I'm doing and get, feedback and really good and insightful tips from all sorts of people from all around in different spheres. So I think that's another thing that I would definitely encourage, people at different stages of their medical training or career to think about and look into.
100%. And so I think, speaking to that, we have the crazy opportunity in 2018 that we don't just touch one patient or one person, we can literally touch millions of people. Obviously, a lot of the posts you make, you maybe get 100 views, whatever, but you went from one person to 100 people that your personal voice impacted, and we've never been able to do that at such a scale. So what you just said is something that we're obviously very interested in when it comes to the podcast, and I think you bring up such an amazing point. And we have beautiful doctors such as yourself who are working very, not to toot your own horn, I think you're an amazing example. And we have amazing doctors who are working very hard, who are very disciplined, who love what they do, working in, your field such as adolescent pediatrics and that focus. And you are an expert, and to really highlight that and to use the tools we have at our disposal to have those conversations, it's wonderful.
Thanks, Taylor. I really appreciate it. Thanks.
Yeah, absolutely. So, Nicholas, Chadi, we've had a great chat. We've had a great conversation, and I appreciate your time here today on the Happy Doc. You've helped me feel more fulfilled. You've provided a focus of appreciating the things that I do in my training, and I know a lot of listeners are going to get a lot out of this conversation. Thank you so much.
Thank you so much for having me.
All right, and take care. Thank you so much for listening to the Happy Doc podcast, the voice of fulfilled physicians. If you enjoyed the episode, please drop us a like, comment, and share. Share us through the social media channels we have on Facebook, Twitter, and Instagram. The handle is at Happy Doc Podcast. That's at Happy Doc Podcast. You can find our website at www.thehappydoc.com. Again, thank you so much for listening to the Happy Doc, the voice of fulfilled physicians.